It's my feel-good breakfast show.
A very warm welcome back to you. It's your feel-good breakfast show on a Tuesday morning, Expresso here on SABC3. Now, Friday marked the 7th year anniversary since the inception of International Alzheimer's Month. And this was created in order to raise awareness and challenge the stigma surrounding the disease. Now, Alzheimer's, of course, impairs memory and mental functions. And here to help us unpack everything that we need to know about this progressive disease is our trusted medical professional, Dr. Darren Green. Always good to see you, Signore.
Thank you, Tenore.
So, Alzheimer's and dementia, sometimes terms that can be confused, used interchangeably by some people. Let's sketch the difference.
Sure. So dementia is just the term used that describes cognitive decline. In other words, so your ability to lose things like attention, memory, language ability, even the simple things of finding your directions when you drive, for example, are dependent on those cognitive abilities. So dementia is a global term. Alzheimer's is one type of dementia. It's one cause and probably the most common. 50% of cases of dementia are Alzheimer's.
Yes.
Otherwise referred to in a funny way as old timers because it's associated with age.
Yes, yes.
Although we do see in certain families and genetic variants that can start quite earlier.
Yeah.
The other causes are vascular dementia, which is due to the blood vessels and lifestyle diseases like diabetes and hypertension, and then a few other more rarer types of dementias.
Yeah, and then of course this one is progressive, which is part of what makes it such a difficult thing to deal with. But let's talk about the early signs of Alzheimer's.
Sure. So often you'll notice on three domains, the cognitive domains I mentioned is that you could forget things. So people refer to memory a lot, but not everyone with dementia presents with memory loss as the first symptom. Some people have problems with planning. Some people have problems with concentration, completing tasks. Some people even lose the plan to, for example, button a shirt. Suddenly they wake up one morning and they've forgotten, how do I button a shirt? And that's quite fascinating. Sure. The other component then, a second component, would be the behavioral stuff, where people would start behaving in different ways. That would imply not knowing inhibitions, depending on which type of the brain is affected more. Also inappropriate remarks at the wrong time, etc.
Yeah.
And losing some of that ability to discern. And then obviously the last part is regarding your day-to-day functioning at home and at work.
Yeah. Has research revealed what causes Alzheimer's?
We don't know. We know that there's some genetic variants that run in families. And what we do know is that even although you might have certain genes that are associated with Alzheimer's, some people have the gene and don't develop the disease. Other people develop the disease and don't have the gene at all. So they really haven't put their thumb on exactly, what the trigger is of those genes. But what we do know is that people with Alzheimer's have a progressive decline in a certain neurotransmitter in the brain called acetylcholine, ACH.
Okay.
So some of the treatment to try and halt Alzheimer's long term is aimed specifically at keeping ACH around in the brain for a longer time to halt the progression that we spoke of earlier.
Fascinating stuff. We'll come back to cover more about this topic. As I said, this past Friday marked the 7th anniversary since the inception of International Alzheimer's Month. And we're with Dr. Darren Green unpacking this progressive disease and just informing you on what you need to know. We'll be right back about that. Yeah, very, very important stuff, man. Got to make those road trips worthwhile for the entire family. Keep the kids safe. But we're back again with Dr. Darren Green, and we're talking about Alzheimer's. Of course, Friday marking the 7th anniversary of the inception of International Alzheimer's Awareness Month. Now, Dr. Green, Alzheimer's, is it hereditary? Meaning, I'm assuming hereditary means if it is in your family, you are guaranteed to have it. Is that what it means to be hereditary?
Yes, exactly. Yes. It's passed on from the one generation to the next or every second generation, depending on the inheritance pattern. So certain diseases are linked to male chromosomes, others to females, and depending on the offspring, you have a certain percentage of chance. Yeah. So with Alzheimer's, we do notice patterns of hereditary in families, definitely. Okay. The age of onset is also important, of early Alzheimer's. Some people can start even in their 30s in certain variants, which is scary. Everyone associates Alzheimer's with people aged older than 65, 70. But that's just because the frequency and the incidence at that rate is at its highest.
Yes.
So certainly, yes, there is a genetic link to Alzheimer's. As I say, what does concern us is the fact that some people have the gene and don't develop the disease.
Whew. Such a maze. So is there a cure, or is there work being done on a cure for Alzheimer's?
Yeah, there's a lot of work being done on how to maintain the prevention of Alzheimer's. I know there was some work done looking at caffeine and whether caffeine has a protective effect with Alzheimer's, work done with omega-3 in looking at how that affects the neurological decline, or as they call it, neurodegeneration over time. In terms of conclusive evidence of that, there's still work to be done. It's not conclusive yet. Yeah. And also what's been done is looking at how to maintain certain functions so that the behavior and functioning every day can continue and you can preserve function. In terms of the reversibility, we can't reverse Alzheimer's at the moment. So there is medication that looks at keeping up those ACH, the acetylcholine levels in the brain. Things like Ibixa and memantine and stuff like that. You'll hear those names out there. And that can be given to mild to moderate Alzheimer's. So the stage of the Alzheimer's is very important as to when to use medication to prevent further decline or not. Yeah.
We've got a caller on the line.
Excellent.
Marie, a very good morning to you, Marie.
Good morning to you guys.
Thanks so much for the call. What is your question or your comment?
My question is there such a test that can detect Alzheimer early?
All right, so a test that can be used to detect Alzheimer's early on.
Yes, so there are certain genes and genetic testing, screening tests that can be done that can see if you have one of the Alzheimer's genes that I've mentioned. Remember what I said earlier on, you might have the gene and not develop the disease. So what are you going to do with the knowledge of knowing that you have the gene? I think you must control and manage the things that you can in terms of your lifestyle and neuroprotective effect. So even things as simple as diet and exercise play a massive role in increasing the rate at which your likelihood of developing Alzheimer's is. Alzheimer's essentially means certain plaques get deposited in the brain. Yes. So there's abnormal protein called amyloid. And what happens is those amyloid plaques, amyloid protein are deposited in the brain between the nerve cells, and it prohibits the signals moving from one part of a brain to the next. And you also get tangled, neurofibrillary tangles that are deposited in between the nerve cells. And that's the structural component that's the problem with Alzheimer's. So in terms of knowing that you have the gene, sure, just speak to your family members. At what age did they develop cognitive decline, etc. as well? And then modify your risk factors for that. There are other tests, obviously neuropsychological tests, in terms of if you are at the age of 60 and you want to know, so how am I actually doing cognitively? What's my immediate recall, my concentration, memory, all that like? They can quantify that for you, and then you can do a repeat test over time to see if you've lost any domains.
Yeah. And maybe also a conversation that a lot of family members should be having amongst themselves in order to develop that kind of family structure where if somebody is suffering from Alzheimer's, they can be assisted properly by their family members as well. All right, we're going to take a short break. We'll be right back with Dr. Darren Green as we continue to discuss our medical topic for today, Alzheimer's. Give us a call on 0214309881. Your Feel Good Breakfast Show will be right back. All right, we're back again with Dr. Darren Green for our Medical Tuesday chat, and we're focusing on Alzheimer's, this being the 7th anniversary of the inception of International Alzheimer's Month, which we're in, was marked on Friday. We've got a caller on the line who's dialed us on 0214309881. Mark calling us from East London. Good morning, Mark.
Morning, Mark.
Morning, Katlego. How are you?
Very well, thank you, Mark. What is your question or your comment?
Thanks, Katlego. Doctor, I just wanted to find out the effect of CBD, cannabis oil on Alzheimer's.
All right, a very relevant question with the legalization of recreational usage of marijuana.
We're going to have quite a few discussions on what evidence we've got out there already in terms of what we're using cannabis oil for in terms of the medical uses.
Yes.
You know, the biggest problem obviously is understanding when it's curative and when it's symptomatic treatment for an array of different conditions, from cancer all the way through. So a lot of research being done on whether it's curative for certain types of cancer, for example.
Yes.
When it comes to Alzheimer's, in terms of the reversibility of those plaques, the amyloid plaques that I spoke about, that are the mechanism involved with Alzheimer's, we don't have evidence that cannabis oil can reverse that process or remove the amyloid or neurofibrillary tangles.
Yes.
So what we're looking at now is obviously people are using cannabis oil for a lot of their mood stabilizing effects and so forth. what people don't understand, obviously, there are different subtypes to cannabis, your THC component, your cannabinoid component, understanding which part is psychotropic in terms that gives you the tripping hallucinations, etc., and can lead to psychoactive cannabis. So considering that, looking at that topic on its own, one would have to look at how the substance is regulated in this country in terms of import, export, and quality control standards. Who's testing it? Who's looking at those different subtypes of the chemical molecule?
Exactly.
And also, what is the evidence that it actually works in terms of the reversibility of conditions and curative versus symptomatic relief? I also have to caution listeners to understand that there's often evidence that presents in terms of cannabis unmasking underlying psychiatric conditions, which is a well-known established fact already.
Yeah.
So if you didn't have schizophrenia, for example, and you take and you
trigger
use
it.
it recreationally, it can often unmask underlying pathology.
All right. Very, very interesting topic of conversation, which I'm sure, as Dr. Green has said, we'll take on another
Definitely.
green day, if you will.
Indeed.
Talk about helping somebody in the family who is suffering from memory loss. I'm sure the initial reaction is shock, possible just not knowing what to do. How do you go about helping somebody in your family who's showing early signs of memory loss that might possibly lead to Alzheimer's?
So the feelings of the person experiencing the loss is absolutely tragic. They are aware that something's changed. They're aware that they're losing their ability to remember things. Some of us forget our keys and we start worrying already that we can't find our stuff. So you can imagine for that person how scary it is, the level of dependence, etc. If you're surrounded by anxious, fussing children, you don't want to even let them know about the different components that you're struggling with. So you hide it, you isolate yourself. People with early cognitive decline, or what they call the pre-runner of Alzheimer's, mild cognitive impairment, learn compensatory mechanisms of how to hide their domains that they've lost. They'll say, remember then at the time when we were at the
and then
you'll
fill in the
gaps.
sentence.
And they learn all that. And how you unmask it often is when you take someone out of their day-to-day home situation where they have all the crutches to help them with their cognitive function. The memory, knowing the way in the house, knowing where things are placed, whether it be sugar, tea, coffee, etc. When you take them to a chalet on a weekend and you're having a getaway, suddenly you start seeing behavior that you didn't even notice in their, in their natural habitat. So people with Alzheimer's and dementia often look a lot worse when you take them out of their home circumstance.
Yeah.
For the family, it's terrifying. You don't know where to start. The first place that you start is saying that we're not saying there's anything majorly wrong with you. We just want to quantify if there are any domains that you've lost, so that in 10 years' time, we can have a look and see how it's changed.
Yeah.
That reassuring, non-judgmental way of looking at things and explaining is very important. And a neuropsychologist or an occupational therapist in psychiatry will be involved with those cognitive
Yeah.
tests.
And I think most importantly, just for them to know that you are there to support them, you are there to help them, you are...
They're not alone, yeah.
Yeah, exactly. That's the most important thing. As you can see, the purple ribbon there marking Alzheimer's disease awareness, which is our focus of our medical chat. We still have one more opportunity to chat to the doctor. Give us a call, 021 430 9881.